To vitiate the quorum call?
Without objection.
Thank you very much. I wanted to speak in particular terms about the American Rescue Plan, and in particular about the provision of home and community-based services. We know that when we speak of these kinds of services, we're talking about services that benefit seniors across the country as well as Americans with disabilities. We're also concerned as well for the heroic frontline workers who provide those services, most of whom, virtually all of whom, have been underpaid and frankly underappreciated for far too long. Let me start with the provision of these home and community-based services in terms of the people that are benefiting from these services. Right now, about 4 million Americans receive home care and home health services in their own homes or apartments. Receiving these services at home reduces the likelihood that older American will be infected by the virus. Serving and supporting older adults and people with disabilities reduces pressure on nursing homes and other congregate settings. We know that these kind of services, the home and community-based services, make sure that seniors and people with disabilities have a chance to continue to live where they want to live, as opposed to living in a congregate setting. In many cases, that means that they'll have more contact with their families, reducing the loneliness and social isolation that can be damaging to their mental health. So this American Rescue Plan includes temporary federal funding to states to increase Medicaid home and community-based services. If the bill were to pass, an additional $9.3 billion would be made available to states to ensure that workers who provide these services have the protection and resources they need to provide the care, to provide the services. 200 organizations from around the country wrote to Congress in support of these new dollars. For months, SEIU, one of the great unions in America representing workers, healthcare workers, the disability community as well, advocates for older adults like AARP and others have rallied around the need for this funding. This funding can be used to increase wages for direct service providers, the workers. It can be used to secure additional personal protective equipment and testing supplies for workers and those that they support. Home and community-based funds can also be used to help people transition from congregate settings back to their homes. It can also be used to provide services for the 800,000 Americans waiting for this kind of help. For example, Ira Hall from Westmoreland County, Pennsylvania, just right in the southwestern corner of our state next to Pittsburgh. In that county, Ira will continue to receive services, and he will receive that service from his direct service worker, Ray Williams. I was able to visit both of these individuals last May during a virtual home visit. Home and community-based services make it possible for Ira, who has a developmental disability, to live in his own apartment. Ray, who is his direct service worker, helps Ira plan his day. It helps him throughout his workday and helps him find the resources he needs to meet his goals. During the pandemic, Ray's support made it possible for Ira to remain in his home, to be safe from contracting the virus. The services Ray provides also helps Ira maintain his physical and mental health. We know that the American Rescue Plan makes it possible for services like those Ira receives and Ray provides. It'll also mean the agencies providing these services will continue to operate and provide essential home and community-based services throughout the public health crisis. Passage of the bill would be a down payment on securing a strong and comprehensive home and community-based services infrastructure, but it's only a down payment. This pandemic has revealed a fragile home care and home health system. These funds should be the first step in creating home and community-based services infrastructure that can serve seniors and all people with disabilities who want to live in their own homes and remain in their communities with their families, friends, and neighbors. With the passage of this American Rescue Plan, we'll be able to address the immediate pandemic needs of older adults as well as people with disabilities. Let's work to ensure this first step starts to create the path to a robust, comprehensive home care and home health network in every state for every senior and every American with a disability. Madam President, I would yield the floor.